And May is Mental Health Awareness Month, and earlier this week, the Louisiana Department of Health announced policy changes to expand the health provider workforce. Colin Vidros breaks down what this could mean for some residents.
It provides opportunities for folks.
On May 20th, LDH announced they plan to expand Medicaid reimbursement eligibility to provisionally licensed mental health professionals while they are seeking full licensure. Those professionals include, but are not limited to, therapists, counselors, mental health clinicians, and behavioral health clinicians.
Those that are able to provide these services within their scope of practice, but haven't traditionally been able to practice in Louisiana prior to this policy change, which is still pending.
The policy change, according to LDH, is for mental health professionals without licensure to obtain reimbursement from the Medicaid program as they are working towards full licensure. LDH's Deputy Assistant Secretary for the Office of Behavioral Health says the department aims to make these services more available for residents who may not have access to assessment, evaluation, and psychotherapy types of treatments.
It gives them the opportunity to have that, which, moves in the direction of improving our health outcomes here in Louisiana.
Much like the rest of the country, Louisiana faces challenges in the behavioral health workforce profession. Approximately 26% of mental health needs are met in Louisiana, according to the Health Resources and Services Administration.
This Mental Health Awareness Month is every day. It's not just 1 month. And we really work to prepare students to go out into the workforce or to go be mental health professionals so they can help other people. But the reality is, if we're not being successful in our own mental health, we're not being successful in our jobs.
It's very important to be aware of the stress, trauma, and potential for burnout on our jobs and connect that to emotional health, physical well-being, and mental well-being.
According to LDH, rule changes and a state plan amendments would need to take place before the policy goes into full effect. LDH expects the final rule to publish on July 20th, with the full implementation expected to begin on August 1st, if the changes are approved by the U.S. Centers for Medicare and Medicaid Services.
I would encourage residents to contact their managed care organizations, their health plans that help provide them with care coordination and things of that nature.
In Alexandria, for News Channel 5, I'm Colin Vidros.